Sorry for the inconvenience. So, I was starting with challenge condition makes the normal function of individual very difficult and leads to dependence. Challenged children is one who deviates from normal health status either physically, mentally, or socially. It is a disadvantage for a given individual resulting from an impairment or a disability that limits and prevents the fulfillment of a role which is normal for an individual depending on age, sex, social, and cultural factors. Okay. So, what is a challenge condition? The challenge condition is one where the individual deviates from their normal function. Okay. So, deviates from the normal health status, either physically, mentally, or socially. Okay. So, it is a disadvantage for a given individual who are what challenge in a challenge condition. So, the concept of challenge is first what happens? Injury or disease take place and it leads to impairment of the individual. Then it leads to disability and later on it results in challenge or handicap condition. Yes, is it clear? Is it clear, everyone?
Yes, ma'am.
Ma'am, definition part.
What?
Definition part not clear, ma'am.
Okay, so challenge condition means the one where the normal functioning of an individual becomes difficult. Okay. Difficult means it leads to dependence. Okay, what do you understand by challenge? Challenge means what? The one where the individual is what? He cannot perform his daily activities like a normal individual. He has to be dependent on others because it leads to impairment because of his impairment or disability of the individual. Yes, is it clear now?
Yes, ma'am.
Okay. So the next part is mentally challenged. So what do you mean by mentally challenged individual? So mentally challenged is now used for the condition mental retardation. So mentally challenged is also used for what? Nowadays it is told as mentally retarded. Okay, so it is generally characterized by low IQ or intellectual function. If the person has low IQ, that is intellectual functioning is low with compared to others, then it is known as mental retardation. Okay. So here is the definition. Mental retardation refers to significantly sub-average general intellectual functioning resulting in or associated with concurrent impairments in adaptive behavior and manifested during the developmental period. So mental retardation is a significantly sub-average general intellectual function. So what happens? Mental retardation is a significantly the individual needs to have reduced what reduction in intellectual function, which may be a result due to what impairments during their developmental period. So if there is any kind of impairments or any kind of what mental retardation used to happen what if there is any kind of impairments during their developmental period. Okay, so what happens? The individual is to have sub-average general intellectual functioning. Okay, so how do you give intellectual functioning? It is generally calculated by in the next you can see mental it is the types it is classified depending on IQ level. So we used to calculate the IQ level of an individual and then used to classify it on different types. Okay, so the types is it is classified depending on IQ level. IQ or intelligence quotient is calculated by the formula is mental age divided by chronological age into 100. So what is a mental age? Can you all say anything regarding the mental age? Do you have any idea? Yes. Do you have any idea? Anyone? Hello. Hello. Am I audible?
Yes, ma'am.
Okay. So mental age. What mental age is it is estimated from a person's cognitive development. So cognitive development, how is it derived? It is derived from some scores. Scores which is given on the basis of some performance on their intelligence or maybe some achievement, or maybe some neuropsychological test. So the mental age is determined from the estimation of a person's cognitive development through some raw scores, which will be derived from their what intellectual scoring or some neuropsychological test. So it will be given as such. Okay. So the chronological age means it is the biological age. It is the legal age of a person's what of a person. It is a biological age. Okay. Is it clear? Hello. Is it clear?
Yes, ma'am.
Mental age and chronological age. Can you differentiate it? Yes.
Yes, ma'am.
Okay. So the next is the types. So the types are, first one is mild or educable. So what is the range of this mild type? The IQ range will be 50 to 70. So if the IQ level, IQ scoring is from 50 to 70, the person will be under the classification of mild. Then the next is moderate or trainable. So the IQ range will be 35 to 50. So the third one is severe or dependent retarded, which will be the IQ range will be the 20 to 35. And profound or life support will be less than 20 IQ range. Okay. So these are the types. Then the next is etiology. Etiology means causes. Okay. Causes of mental retardation. So what may be the causes of mental retardation? First one is genetic factors. Then it may be also prenatal factor, perinatal factor, postnatal factor, and environmental and social cultural factors. So these are all the factors which may be the causes of mental retardation. So the first one is genetic factors. So under genetic factors, there is this Down syndrome. So anyone have any idea regarding Down syndrome? Have you ever heard of Down syndrome?
Yes, ma'am.
Okay, so what is it? What is Down syndrome?
It is, ma'am, like defect of 21st chromosome, ma'am.
Yes, so it is the defect of the 21st chromosome. So this defect happens in the gene. So it is under genetic factors. So the next is epilepsy. Any idea about epilepsy? Any idea? Epilepsy? Hello. Any idea? Do you know what is epilepsy?
No, ma'am.
Okay, so epilepsy, it is a
A
disorder
type
of
of seizure.
what? Yes?
Type of seizure.
Yes, yes. It is a type of seizure. Epilepsy means seizure. So the disorder is in the nerve activity in the brain. So it is known as epilepsy. So hydrocephaly. What is hydrocephaly?
Water in brain, ma'am.
Yes, it is the fluid buildup in the cavities of the brain. Okay. So these are all these factors. There are more, but mainly these are the factors which are the causes of mental retardation. So the next is prenatal factors. What do you understand by prenatal stage? What is prenatal?
Before the birth, ma'am.
Yes, before the birth of the baby, it is known as the stage is known as prenatal prenatal stage. So what is under prenatal stage? Prenatal factor. There is infection. So infections might be what such as rubella or syphilis. All that are under the infections of the prenatal sector. Okay. So the intoxication. Next is intoxication. What do you understand by intoxication? Any idea?
Poison, ma'am.
Yes, poison. It may be poison, but mainly it is what substance abuse or certain kind of drugs. Okay, it is known as intoxication. So it is also, like you said, it may be also what poison. So the next is physical injury and disorders. Okay, so there will be some physical injuries, or there may be some disorders during the prenatal stage. So, which may be the cause of what mental retardation. And the next is endocrine disorders. Any idea about endocrine disorders?
Like, ma'am, diabetes, thyroids.
Yes. So endocrine disorders are mainly diabetes mellitus and hypothyroidism. So these are all the factors. These are all the factors under prenatal factors. Okay. So next is perinatal factors. What is perinatal factors? So perinatal factors will be what? The perinatal stage. Any idea about perinatal stage? Any idea? Perinatal. Here you can see
During
the
the time of delivery, ma'am.
yes during the time of delivery. So it is that stage where there will be one delivery of the baby. So prolonged or difficult birth. That is, if the birth of the baby takes longer time than required, then it is known as prolonged or difficult birth. So it prolonged birth is not a good sign of a what of a healthy birth. So it may lead to what? It may lead to mental retardation if there is prolonged or difficult birth. Next is prematurity. Prematurity means premature birth. You all have heard, I guess. Yes. Have you ever heard premature birth?
Yes, ma'am.
Yes. Premature means which used to occur before a given time, before a proper time. So it is known as prematurity. Then carnic terrace. Have you ever heard about carnic terrace?
Yes, ma'am.
What it is?
It is, ma'am, high level of bilirubin that damages the brain, ma'am.
Yes, yes. It is the high levels of bilirubin, and it what? It results in brain damage. So carnic terrace. So uh, these are all the disorders in parental factors. So under postnatal factors, postnatal stage. What is the postnatal stage?
After the delivery of the baby, ma'am.
Yes, after the delivery of the baby. So under that, there is infections. Infections such as septicemia may be there, measles may be there. So these are all the infections under postnatal factors. And there are accidents. So accidents may be there after the delivery of the baby. So these are all infections and accidents is under postnatal factors. So next is environmental and socio-economic factors. So first one is low socio-economic status. So low socio-economic status may also be a cause of mental retardation. Okay, the inadequate caretakers. Inadequate caretakers means if the family members or anyone who is taking care of the baby, if the care is not adequate, then it may also lead to mental retardation. The next is child abuse. If there is child abuse, then it may also lead to mental retardation. Yes, are you all clear with the etiology?
Yes, ma'am.
Okay. Then next is sign and symptoms. Okay, so what will be the sign and symptoms of mental retardation? So now number one is failure to achieve developmental milestone. Any idea about developmental milestone? What do you understand by developmental milestone?
Those are, ma'am, basic things in children that are seen, like sitting and
Yes,
walking, that is smiling, all things, ma'am.
yes. So developmental milestone are the behaviors, okay, or some skills which will be seen in children or infants in a given amount of period. Okay, so these are all the developmental milestones. So if there is failure to achieve any of the developmental milestones, then it is a sign and symptoms of mental retardation. So next is deficiencies in cognitive functioning, such as inability to follow commands or directions. So deficiencies in cognitive functioning. So if there is any kind of deficiency in cognitive functioning, which is inability to follow commands or directions by the family members or anyone. So if the child is not able to follow the commands or the directions, then it may also lead to what? Then it is a sign and symptoms of mental retardation. Next is reduced ability to learn or to meet academic demands. So if the individual or the child is not being able to meet the academic demands, okay, to not being able to perform in their academic work, then it may what? It is a sign and symptoms of mental retardation. So next is difficulty performing sensory activities. So if the individual or the child is not being able to perform their daily self-care activities, then it is also a sign and symptoms of mental retardation. So the next is low self-esteem and depression. Because of the child or the individual which will be not be able to what? maintain his or perform his daily activities. So what the individual will feel? The individual will have low self-esteem, sorry, and it may also lead to depression. Okay, so the next is irritability when frustrated or upset. So the individual will be irritable due to frustration or any kind of upset. So the next is lack of curiosity. So the individual or mainly the children used to have what lack of curiosity because their cognitive functioning is reduced. So due to that they have lack of curiosity. So the next is neurologic impairment. So neurologic impairment means if there is any kind of damage to the nervous system of the body. So it may lead to what? It is a sign and symptoms of mental retardation. So are you all clear with the sign and symptoms? Is it clear? Any doubt?
Yes, ma'am.
Any
No, ma'am.
doubt? Okay. So the next is treatment modalities. So what is the treatment modalities of the mental retardation? So first will be behavior management. So the individual will undergo behavioral, behavioral therapies. Okay. So the next is environmental supervision. So the environmental supervision means there will be the individual's environment will be supervised and will be what and treatment will be done of maintaining the environment more comfortable for the individual. Okay. So the next is monitoring the child's developmental needs and problems. So there will be constant monitoring of the child's developmental needs. So what are the developmental needs or if there is any kind of problem, so there will be constant monitoring of that thing. Okay. So the next is programs that maximize speech, language, cognitive, psychomotor, social, self-care, and occupational skills. Okay, so there will be what? There will be programs which will maximize their speech skills or their cognitive skills or self-care skills, etc. So family therapy to help parents develop coping skills and deal with guilt or anger. So there will be family therapy which will help the parents to cope with the disease of their child. So there are any kind or dealing with guilt or anger. Okay, so next is early intervention programs for children younger than 3 age with mental retardation. So there will be early intervention programs. So under that they will provide day school to train the child in basic skills such as bathing and feeding. So they will be providing day schools so that they could train the child in basic skills such as bathing or feeding. Okay, the next is vocational training. Vocational training will be given to the individual or to the child. So what is a vocational training? Vocational training is the one where the child is educated on some specific careers or some specific areas. So they will be providing that vocational training to the children younger than age 3 with mental retardation. Okay, is it clear? Is it clear, everyone? Treatment modalities.
Yes, ma'am.
Okay, so the next is prevention. So what will be the prevention? How will we prevent the mental retardation? By first one is by genetic counseling. We will be providing genetic counseling so as to detect any kind of genetic disorders. Then the next is immunization. Immunization will be provided to the mother who will be in the pregnant period. And next is adequate maternal nutrition. So the maternal nutrition should be adequate and it should be but full of nutritional foods. So the next is avoidance of teratogenic substances like exposure to radiation and consumption of alcohol and drugs. So avoidance of exposure to any kind of radiation or the mother should also avoid consumption of alcohol and drugs. Next is proper nutrition of children throughout the developmental period. So there will be proper, the child should be fully provided with nutritional foods throughout the developmental period. The next, psychiatric treatment for emotional and behavioral difficulties. So for any kind of behavioral or any kind of emotional difficulties, the parents, the family members should take them for the psychiatric treatment. Okay, so these are the prevention of mental retardation. Is it clear, everyone?
Yes,
Yes.
ma'am.
Okay, so the next is care and rehabilitation of mentally challenged. Okay, what will be the care and what will be the rehabilitation of the mentally challenged individuals? So first one is regular assessments of mentally retarded persons. So there will be regular assessments of the mentally retarded persons, okay, by some professionals. Then advice, support, and practical measures for families. So there will be advice or any kind of practical supports or measures for the family members of the individual who are mentally challenged. Okay, so the next is provision for education, training, occupation, or work appropriate for each challenged person. So there will be provision for education or any kind of training so that they can work appropriately in their working areas. Okay. The next is housing and social support to enable self-care. So there will be some housing or any kind of social support to enable their self-care activities. Okay, so next is medical, nursing, psychiatric and psychological services. Those who require them as outpatients, day patients or inpatients. So there will be provision of medical, psychiatric, nursing and psychological services who will require them as outpatients or some day patients or inpatients. Those patients who will be coming as outpatients in the outpatient department or day patients for some checkups or inpatients. Yes, is it clear? Care and rehabilitation. Hello, is it
Ma'am,
clear?
what is different? What is
What?
different in treatment modalities and this
What?
care?
Treatment
Difference in
modalities and care. Care and rehabilitation agency, which will rehabilitation is mainly in a group of individuals who are who can no longer be treated. Okay, rehabilitation means they will have that disease or the any kind of disorder and they can be treated. Treatment means treatment is given to those individuals whom after getting the treatment they can improve their disease or any kind of disorders. Okay, and care rehabilitation means those patients or those individuals to whom they can recover from that disease or disorders. Yes, is it clear now? Treatment is
yes,
given
ma'am.
to those who can be recovered from that disease or disorders, and rehabilitation and care is given who cannot be recovered from that disease or any kind of disorders. Is it clear?
Yes, ma'am.
Okay. So this much for today. Yes, is it clear for everyone? Any doubt?
Yes, ma'am.
Any doubt is there? Any doubt is there?
Ma'am, how can we calculate this mental age?
Yes, like I said, mental age we can calculate through mental age means we can calculate through some scores. Okay, the individual will be given scores regarding the intelligence test. So there will be some test, intelligence test, or some psychological or neuro psychological test. So these tests are done with that individual, and then only we can calculate the mental age. Okay. Yes, is it clear?
Yes, ma'am.
Okay. Any doubt? Any more doubts? Are you all clear or not?
Yes, ma'am.
Okay, so this much for today, and please provide me the attendance in the group.
Thank you, ma'am.
Okay, thank you.
Thank you, ma'am.
Thank you.